Good evening. It's been called a crisis for years now, and despite all the work that's been done, including this safe injection site here at Yonge and Dundas, we're learning the opioid overdose problem isn't getting better. In fact, it may be getting worse.
It's a problem that has existed since I've been a paramedic, but it continues to be a problem today. In fact, the problem has become worse over the last few years.
He's been a Toronto paramedic for over 30 years, and Superintendent Attila Bodo says he's never seen this many overdose-related calls. Between August 2017 and September this year, preliminary data from the city states Toronto paramedics have responded to 3,585 fatal and non-fatal suspected overdoses. That works out to be about 60 non-fatal cases and 3 fatal cases per week on average, and paramedics have administered naloxone in an average of 8 non-fatal cases per week. A quick look at this graph shows calls nearly doubling from late last year to now. This has changed how emergency responders work, including paramedics and now Toronto police officers who have to carry naloxone on them. The medication is known to temporarily block overdoses.
There's certainly been a lot more attention related to opioid overdoses over the last few years, for sure. I would say that the heightened attention that's been placed on it, I've never seen that to that degree. And also, in conjunction with that, the amount of training and the protocols related to treating narcotic overdoses in the field has also seen a lot of forward initiatives.
This map shows suspected opioid overdoses over the past year in Toronto. The top 10 intersections with the highest numbers of calls are in dark red, and they're all in the downtown core. The standouts, the Church and Yonge area with 358 calls, Moss Park with 337, and the Bay Street corridor with 158 calls. But experts warn these overdoses are happening everywhere, including in smaller pockets throughout the city.
One of the things that we think is behind the increase is the drug supply, and it's quite toxic. There are a lot of contaminants, including fentanyl, synthetic fentanyls like carfentanil. People don't always know what's in their drugs, the potency of what's in their drugs, and that's what's of concern to us.
Looking at the numbers, there was a 63% jump between 2016 and 2017, and according to the city, 1 in 4 opioid overdose deaths in Ontario is in Toronto.
The numbers are concerning. Every death is of concern, and the fact that the numbers had been going up over the past few years is certainly of concern to us.
At what point do you think we're going to kind of see some relief?
So it's hard to say without knowing the changes in the drug supply, and that's something that we don't obviously have a handle on because it's an illicit supply. We've also put into place programs like our supervised injection service that, help people bring people in so they're not injecting alone in unsafe places, and trained staff are there to be able to reverse overdoses should they happen.
And one of the concerns flagged by EMS, they say some people still aren't calling when they do suspect that there is an overdose of some sort. So they are urging anyone who may find themselves in this situation to dial 911. For a closer look at these numbers and the maps, you can head to our website, citynews.ca.